On to corkies, so how we manage and treat corkies. So obviously, most of the time, the player is going to realise that someone's running and either need them in the thigh or calf, or it can happen in any muscle in particular, but often we see them in our thigh muscles. That's the most common. It's most commonly caused by a knee in a tackle or trying to get around someone and that sort of thing. So a lot of the time, depending on how severe it is, the player might be able to continue, or they might not let you know till after the match, but sometimes they might need to come off or let you know on the water time or on the breaks through the match. So in terms of what's happening there, is obviously we're getting a blunt trauma, so it's not an overstretch of the muscle or anything like that, it's trauma into the muscle, but it's causing a similar sort of reaction, so there's bleeding within that muscle that's going on. Okay? So how do we manage that in that first little bit? So I guess it depends on how severe it is. So there's a few things that we need to look at in terms of trying to work out how severe it is. And obviously with any injury it can range from quite mild to quite severe. One of the things that if you've got a really bad corked thigh, that you're not going to be able to do very well is bend their knee, so putting it on stretch. So one of the things that we can do is test how much they're able to stretch that muscle in terms of pain. Yep. So we can get Johnny here to lie on his side facing that way. Often, so if he's done his left one, we get in line with his right side. This is a quick way that we can test that. And we're getting him to, we can actually take that knee and bend it up. And you can actually stand over this side and bend it, and you can actually feel for around that where that's sore as well and how it's reacting. And you can see how much movement he's got. Can you get it all the way up? Or is it really coming in pain, at 90 degrees, or can you not even get anywhere close to that? So this is going to be a little severe one. If he's stuck down through here, if he's on your mild one, he's going to be able to get most of the way up without too many problems.
So are you moving his leg then?
I was moving it.
Yeah, so it's best to do it that way rather than get him.
You could get him to do it as well as an active type thing, so you might look at both sides of things. But basically, both are probably going to be restricted in this case. Yeah. Because it's putting them up. Both are putting the muscle on stretch, and both are going to start to aggravate where that's.
There's no great difference between them.
There's not a huge amount of difference. No, that's fine. So that's one thing we can look at, and might give you an idea of how severe that is. The other thing is obviously how they're moving, how they can move it to you. Are they able to weight bear? Are they limping? Or can they run? That sort of side of things. Good. And that might give you a bit of an idea of can they keep playing? Do they need to come off at that stage? That sort of thing. So anything that's quite severe and they're lacking some of that range of movement, depending on whether it's a grand final or whether it's just a normal league match, is probably you're going to need to think about the consequences. If they're continuing to play, then are they going to do more damage? Maybe it's best to come off. If it's grand final, maybe you might be able to get them up and get them out there to finish off the match. Good. Initially, so if we decide they're not going to play, then starts our sort of first, the initial management side of things. And we obviously, it's a bleeding in within the muscle, we need to calm down the swelling, and that's really important. That's when our sort of RICE principles come in, so rest, ice, compression, elevation, which you all know relatively well. This is where you as trainers have a really big impact on this guy's injury as well. We need to get that going really quickly in that first 48 to 72 hours. They might not get to see a physio or someone else before that time, so that's when your advice is really important, I guess. Yep. So in terms of that icing, normally with the corked thigh, you can use like an ice pack or a bag of frozen beers, whatever you're generally using. And often it's good to pop it on a bit of stretch when it's on there. Yep. So normally you ice with stretch, and the good way of doing that is again in that side position, where you could have them in that side position through there, and have them like a towel around here, or keep them in that stretch position, or you keep them on that shirt, and you can strap it on around over that area where you've had the corky. Yep. And actually have it on a bit of stretch while you're icing it. And you can do that for the first 48 to 72 hours. Yep. In terms of how you would ice, so initially you might do 10 to 15 minutes every hour, and then for the first day, and then start spacing out, maybe going up to 20 minutes every 2 hours throughout the end of that 48 to 72 hour period. Now it can go on for 72 hours that you need to ice, because it's a really severe one, that's how long you would take it. If it's only a minor one, you might only do it for 48 hours, but obviously it can still be bleeding within that area and within that time frame. So you want to ice until you're fairly confident that it's stopped bleeding within the muscle, basically.
why are you doing it? Is that just to get larger surface area to ice on the stretch?
No, you're doing on the stretch. One of the reasons that you want to do on the stretch is if the muscles in that shortened, the knee straight in that shortened position, there's a complication when you get a really bad corky. You can get calcification in that muscle. So it can, if it's not treated properly, where that injury is and where that swelling is can actually start to calcify and actually turn into almost into like basically bone, and that can lead to some dysfunction in that muscle going down there. So if it's in that shortened position, then that's sort of can, I guess, put that more at risk. And so if we stretch if we do with stretch with ice, then that's a nice way of just trying to reduce that risk and open up and stretch that a little bit as well. You're not taking it to the point of pain. Obviously, if they're really limited with their range of movement, then you're not going to yank them all the way up into there and put them into pain when you're icing it. But that's definitely something that's going to help maybe reduce the risk of that happening. Yeah? So in really severe ones, it is really important that you're looking at that management or maybe referring for onward advice, medical advice if it is, because that is something, a complication that can turn up if it's not managed properly.
During a game,
Yeah.
if the guys come off with a mild
Yeah.
corkies, and you just having a bit of trouble moving it, but it is getting better, what's the best way to manage something like that?
So you could try a bit of compression around that area. Yeah. So again, you could do the EAB tape, and gentle compression winding up through there, or kinesio tape, and sometimes possibly offload. The idea, if you're needing to do that, the question is again whether you should be playing, continuing to play with that sort of thing. And I guess that's up to you and up to the situation and the match, and I guess up to the player and the winners sometimes as well, if they're feeling all that. Yeah.
You're not going to ice him though if he's...
If he's going to go down with the play, you're not icing, no. Obviously not. No. So if he's icing when there's no further, the game's done for him, and then you're starting that icing process. Yep.
Can you ice spray it and compression?
Yep. Probably an ice pack is good. Oh, to go back out.
Yeah.
If it's a mild one, then that's the stuff that you might be able to do. Yeah.
Oh, okay.
Just to kill some pain.
Exactly.
To kill some pain.
Yeah. Yep. Good. Other things you can do is the compression side of it. So compression you can actually do really nicely with that elastic wrap tape, starting from low, wrapping and gently coming up across the thigh. So again, you're helping to try and get some of that swelling shifting upwards. And you might have that on for the first day or two, that first 72 hours. You might redo it the next day. That sort of thing. So that's a useful thing to do in terms of that compression side of things. Other things that can be helpful is that kinesio tape. Which you might not be comfortable doing yourselves, but sort of physio-wise we can put that on, and that can be a useful thing in reducing swelling and that side of it as well. Alright, so that's initial management at the start. Obviously you can also look at elevation in terms of that, and then when we want to, kick the ball or run around and that sort of stuff. Severe ones that might need crutches or something like that to actually mobilise. Yeah. Good. After that sort of 72-hour period where we're pretty certain that muscles calm down and we've stopped that bleeding. The other thing to quickly mention as well is obviously in that time, no massage. Okay, in that first 72 hours, it's really important that we're not getting in and we're not massaging, because that's actually going to make it bleed a little bit more. Okay. The other thing is probably advising the player not to actually drink alcohol, because that's going to make it bleed as well.
Yeah.
So, whether it falls in deaf ears or not, but again, that's going to help with that recovery. And again, keeping up with that regular icing is going to be really important as well. So, some professional teams the player would stay over at the club and they'd be waking them up regularly to ice throughout the night, that sort of stuff, in order to manage and be able to get right for the next, hopefully for the next week, depending on how bad it is. Good. So we talked about the quadriceps muscle beforehand, so more than likely it's going to be coming on in that lateral quadriceps part of the muscles on the outside part, and possibly catching part of that iliotibial band as well. And there's two types of sort of contusions or corkies, and depending on whether it's actually in the actual instant, it's sort of split through the fascia that comes around and wraps around the muscles, then that swelling can spread into other parts of the muscle, and you might get bruising that extends all the way down, or you can get ones that are just within the muscle and that become really quite tight and that sort of stuff. in the thigh it doesn't happen too much, but in the calf that was the case, and there was really a lot of swelling. You can get things like that compression type syndrome where, or compartment syndrome where it's getting too tight and it's starting to restrict blood flow or nerve conduction down to it. So you've got to watch out for that side of it if that's in the calf more than in that thigh, but it's just really look out for. Good. In terms of our treatment technique, so we've done our taping and our icing, and after sort of 72 hours, we're pretty happy it's calmed down. We want to know maybe which muscle it is. So more like we're thinking it's into this muscle. And you can test that with that stretching of the quadriceps. You can also test that strength-wise if you wanted to as well. So again, lifting that leg up with the knee straight is going to test some of the quads, or you can try and put your knee underneath and break, so that to test it. So you're bending at the knee, so that's testing that some of those quadriceps. So on some pain or weakness, and that is going to tell us you're on that right sort of muscle. You can actually, after that 75 period, you can start getting into doing some light massage around that area, okay, and then building up that over the next little bit. So in terms of what massage might be useful, depending, you can obviously feel around, you can palpate around through that muscle, and you're going to feel like the area that's been affected. It's going to be swollen, it's probably going to be warm to touch compared to the other side. You're probably going to feel like a really tight area through there. The main massage technique we want to use is that effleurage. We're going to be starting to try and work through that muscle and shift some of that swelling and bleeding upwards away from that area. Yep. So often with the effleurage, you can cup together like that and sort of do a bit of a squeeze as you're moving up. You're always going to go from low to high, basically, so you're shifting stuff up towards the top of the body through there. So working over through that area. You can work around the sides, so you can kind of use your finger pads again and work around where that actual part of the muscle is injured, and keep working up. You could do that in slight stretch as well, so you could get him onto his side, have a slight stretch coming around through that area, and then he might even be able to, or you can even come around through this side and keep it through there into the crook of your knee and start working up into that area as well, a slight stretch, and work into opening up and stretching, getting a bit more length through that take, how severe it is. You could start using heat after that time as well. So heat treatments are fine enough, so you don't need to use ice there once it's all stopped. And then you're going to be slowly building up their strength and physio guidance, getting back into their running, and do things like squats and single leg squats and knee extensions to work to build up that strength of that injured muscle, and then getting back into your playing side of things. Cool. So it'll be a gradual process. Yep.
With a really nasty corky, you get lots of swelling drifting down into the knee joint and then down through the calf and into the ankle. So you've got to keep an eye on that, and you can massage effleurage.
Exactly. Yep.
So sometimes you've got to clear here first and make your way down, so you're actually clearing all the lymphatic system as you go. So start here and work your way down to the foot rather than going from your foot up. Does that make sense?
Yep.
You start at the foot, you've got nowhere to push it to, but it's all clogged up above. So you work your way away from it. Yep. That can be sometimes the worst thing for them, is not being able to move their knee joint or all that gunk stuck in their calf.
I reckon bikes are really great for these guys too, like 48 hours to 72 hours depending on how severe it is afterwards. Like bikes are really good to just get that knee going and then the quads going. Obviously very little resistance on the bike, but actually you just roll out. And they start with a seat quite high. So most of you've got, an exercise bike. A lot of you've got exercise bikes at your club. So, if they did it on a Saturday afternoon and it wasn't a severe corky, by the Tuesday, and you're pretty confident the bleeding sort of settled down and they've done the right thing by Tuesday, quite often they can start rolling their legs over, no resistance, and it's a really nice way to get that leg moving as long as pain, and very little resistance on the actual muscle tissue itself. So a good thing for these before they even get into the running stuff.
I was just
going to say with the bone deposition thing that Josh was talking about with re-bleeding a corky, to put it in context, it's kind of like ruckman. You may have seen it for those that have been around for quite a while, where they've got repeated trauma, just knee after knee after knee over the years, and getting a hematoma, and then it re-bleeds and so forth. So you've got to be a little bit careful with that. But they're the sort of category that you often see that in, would be the ruckman that have just copped it for ages over the years.
So your way you know that there's something wrong is they're not getting better. They'll get to a certain point and then they'll stop and they won't get any better. So hopefully they've had help before then, but if you've got a player like that that's just not able to get back to their pace or kicking distance or things like that, and they've got ongoing pain and trouble after using it, that needs to be checked. So.
Well, they get severe pain too. It's painful, but it starts to get better and then it gets worse really suddenly.
Yep.
They get really bad pain suddenly 1 to 2 weeks later. That's how they group.
So we're actually not going to practice this massage now. So we're going to skip straight to the next one.
Sounds
Can I
good.
ask one question? We use the tubular compression.
Yep. But the
Is
tubular
it
grip.
Yeah,
Yep.
that they just pull up and have a look. Now you try to tell them to continue with it even days later, and you find that they totally not. Is it advisable to sleep in it as well? Is that okay, or does the pressure of that can cause?
Just with the
sleep?
tubular grip, it can roll up.
Mm.
It gets in sleep,
Can
and
be
so
a
it rolls up and
cut,
pulls a
yeah.
tight band, and it
Because I always say
potentially
no,
cut off circulation.
but I just
Yeah.
wondered what your
I
verdict
mean,
was.
normally I don't advise people.
Yeah,
It's
that
just to
night
wear that at
take
night.
Yeah.
So obviously that's not a night thing, but
Bandage is fine though.
yeah.
Yeah,
The Coban
we use the
wraps.
true.
The Coban wrap's the best
Coban
one.
wrap's the
Elastic
best.
wrap, which stays on.
To reuse it.
So our wrap that we use straight away to put our ice on, are you talking about that?
Yeah, it's quite stretchy. No, it's
That's
just
Okay,
lightly
I've seen that.
glued and really stretchy.
Oh, we've got that.
And it only sticks to itself.
Sticks to
Is that
itself,
right?
correct.
Oh, I know what you
You've got
mean.
that.
Yes, we've
Yeah.
got it.
Yeah, that's perfect for
We didn't know the name.
Perfect.
So we've got it in our side pouch of our bag.
Yeah.
That brown
It's
stuff that
expensive.
sticks
Yeah,
on itself.
brown.
Yes, I keep telling them. Yes.
Yeah.
So just a couple to keep up to date on what's in
Go
yesteryear.
over. Yeah.
There's so many variations with your ice. One is use your ice and then take it off, you reapply it when it gets back to tempered heat rather than just your 20 minutes or your, there's another one 20 minutes, 20 off for 4 hours and then every 4 hours after that. So there's so many variations. Then you get your compression. You put your compression on first, you put your ice on, others say you put your ice on, you put your compression. Which is a better method?
Ice.
No pressure.
It is true though. It is very.
I think it's what you find in your experience what works
Ice.
best.
Everyone will have a different answer.
Yeah.
We were just chatting about it before. A
Hot
common.
compression anyway.
We like to ice regularly, so you can't have the ice on for too long. So any more than 20 minutes causes vasodilation, which is the opposite of what you want. So 10 minutes every hour we'll often do in that real acute phase, and then as it's getting better and there's less heat and it's more of a recovery thing, like they're back to doing some light running and you want to ice after, 20 minutes.
20 minutes.
Yeah.
Okay.
Yeah. So if you want to do it more often, you just have to shorten the time a bit.
Is the washing soda still in or is that out?
Yep, so the washing soda is good for drawing fluid out. So it's got nothing to do with the inflammatory process, it's just getting fluid that's trapped around the joints.
But you can't use the two combined. You either use that or
I
ice.
can use both.
Or
You
one or the other.
both? Yep.
Is that right?
You can use
You
both.
can both.
You
Yeah.
can use both.
Joints though,
Yeah,
ankles, knees.
each bony type of,
Yeah, you wouldn't use it on a hamstring strain, it's no point.
no point.
No, because it will sort of just drift down with gravity. It's where the points where it's trapped.
Okay.
Joints.
Hips, knees. Oh, not hips, knees, ankles, knees.
So the corky may be accompanied with or without bruising.
Yeah, so it depends on the player a little bit. Most of the time you're going to get some sort of bruising with it. But some players or some people don't bruise as easy as other people do. And it depends on whether it's that so it's within a muscle or whether it's spread through different parts of that compression. So you probably get more with some of the other stuff because it's just in that muscle. It might not bruise as badly, but it might it's still be quite severe. It's contained in that muscle.
Yeah, we bruised inside, but you can't see it.
Yeah.
The fascia's sort of stopping it from getting out. They're probably the worst ones because
because there's nowhere for it to
it's
go.
all
and it's
contained
just-
in there and it can't. Yeah.
They just seem to be more sensitive to some degree.
Yeah.
Yeah.
Yeah. The body takes a lot longer to reabsorb it. It's trapped in there.
How about if you have corky, say, right next to the bone on the leg there? What's the best way to manage something like that?
You've got to be careful if they've got trauma right over that area, whether can like so I've seen people where they've actually fractured the fibula and they've got a lot of trauma through there. So you need to establish whether they've done that or not.
Management-wise,
Management-wise, you're doing the same sort of things initially in terms of your ice and that sort of stuff. And then also in terms of stretching, or what was the question?
Yeah, I mean, it's one of those areas you can't stretch really easily into right there next to the bone.
Yeah, well you can stretch it this way, so you need to get them sitting on their heels or stretching through like that, or bring that foot across, and that's gonna stretch it's in the tibia muscle or the perineal muscle, isn't it?
You can do bony bruising,
Yeah.
or contusion of the bone, and that takes a lot longer to get that up.
Yeah. A lot longer,
Yep,
yeah.
so it's just going to be time. Yep.
But yeah, best way to stretch is sort of like that, if they're sitting on their heels or stretching through there without a shoe. Yeah. Alright. Excellent to do.